Hi, my name is Dr. Dev and this is my assistant Barney. Hey Barney! Today we're going to talk about how to get rid of your restless legs. You know, there's a lot of BS around, so this video will tell you the truth. Today we're going to talk about restless legs. As a sleep doctor, this is a question I get all the time. How can I get rid of my restless legs? I've tried so many things, please help. Well, if you have restless legs, you will know how irritating it can be. It's characterized by the feeling of creepy crawly in your legs, the inability to keep still, the feeling you have to stretch and move, and if you're trying to go to sleep with restless legs, you ain't gonna sleep. Now, many people have tried all sorts of things, such as weird socks and bath salts and having a bath before they go to bed. That should be for washing, shouldn't it? Not for restless legs. But there's a few things that you need to know about restless legs to give you an idea of what to do to treat and get rid of restless legs. First of all, it's due to a lack of dopamine in the neurocircuitry system of your legs.
Yes. Well, this is nothing to worry about.
And one of the particular features of dopamine production, it needs iron. So a third of people with restless legs have actually low iron levels. So if you have restless legs, go and get your iron levels checked because you might be anemic, for example. And I see this in quite a lot of women who are losing iron on a monthly basis through their periods, or pregnant women where their iron levels are a little bit insufficient. Now, as a result of knowing you have low iron levels, one of the treatments of restless legs, guess what, is iron supplementation. But many people also get some benefit from magnesium supplementation as well. However, many patients that I see have done all of that and they still have terrible restless legs and as a result, quite terrible initiation and maintaining of their sleep, i.e. insomnia. And even when they are asleep, the legs twitch, and this is called periodic leg movements. Now, in some of those cases where it's very severe and they've done all the simple things, such as the iron and magnesium, and even cutting down caffeine and high cocoa in chocolate, they still have immense problems with insomnia. And so what do I do as a sleep doctor? One of the medications I use sometimes is pramipexole. This is a dopamine agonist. Another example is ropinirole. And what this does is basically replenishes the dopamine levels in your circuitry system, so it reduces all that irritability in your feet. However, many patients who are on pramipexole, they find that they get something called augmentation, where in fact, as they increase the dose to get more relief, they need a bigger dose. This is called a tolerance effect. And then as you're having more and more pramipexole, this can cause side effects, particularly nausea, and in fact causes more sleepiness when you wake up. Crazy, isn't it? So what do patients do when they come to me and they've been on pramipexole? Well, some doctors are using other drugs like benzodiazepines to put them to sleep. Does not work. Benzodiazepines such as temazepam or diazepam or something called clonazepam doesn't really work for restless legs. It might sedate you, but the legs are still twitching away and will cause sleep disturbance. Now, one trick that I have used successfully, and we're beginning to realize it is working more and more in research that's coming out in restless legs, and that's the role of medicinal cannabis or CBD or cannabidiol. And I've had quite a lot of success in people using CBD oil at night time just to bring that busy brain down and that restlessness in their feet. And so CBD oil might be one option that one might consider if they have restless legs and tried everything else. But interestingly, those who've got chronic pain, particularly in the lumbar spine, L4, L5, S1, they have a lot of restless feet and restless legs, almost like something called a neuropathy effect. And for those, a lot of them find relief with painkillers. And I see a lot of people actually who've been on endone or codeine to help the restless legs. But actually what it's doing is trying to treat the pain from the disc disease they have in the lumbar spine. And in those patients, CBD will help. But if you're trying to improve the pain control, I might add on a little bit of THC or Tetrahydrocannabinol with the CBD at night time. And therefore, I have found that those with restless legs, particularly with the chronic pain element and the insomnia and the anxiety as a result, medicinal cannabis can be an exceptionally good alternative to the other things that you've read about that frankly do not work. So if you're suffering from restless legs and you've had enough of all the BS that's around, then go and get some advice from a sleep doctor, particularly those who've had some experience with cannabinoid medicine, just to get better sleep and basically cut the crap. See you next time.